Welcome to the HealthOne 2015 series of recordings. We're going to talk about the pregnancy management module in HealthOne version 7.5. In order to find out what version you have, you should click on Help and About, and you'll see the version number here. If you have version 7.5.0 with any number after that, then this video is relevant to you. I'm going to open a patient who happens to be pregnant. I know this because the pregnancy tab is to the fore once I open it, and I see here this is her 7th recorded pregnancy and she's 31 weeks. Here I'm going to talk about sending letters regarding the pregnancy by clicking on the administrative button here. You have three options: the maternity application, the referral letter to the hospital, and the maternity claim. And we will be encouraging you to use this method of doing your application and your referral and your claim rather than the old way, but you can use the old way to do your claims and to send in your maternity application. So I'm just going to show you both ways. Normally, when you have recorded a pregnancy up to now, you will execute a document template and you call something like a maternity application. I call this old, and you click on that and it'll be filled in, and you'll have all your local details here yourself already put in, and this will be your application to the HSE for this patient, and that will continue to work with the version you have now, with this new version. The next one that you will do is you would do perhaps the maternity referral, and I've just called this old as well. And with the maternity referral, this is one of the problems. HealthOne does not know exactly when this pregnancy started. With the new module, this becomes redundant. 1/1/2014, you'd put down something like the beginning of the year, but it's hard to know when you tick that. So HealthOne now will take all obstetric transactions from the date you put in, and so that's the pregnancy referral. So that's the second document that you may well be using at the moment, and you can continue to use it as I've just shown you. The next document, and the last one that you might be using, is the maternity claim, which is the most important one probably. And this one again has the same problem. You have to put in a date, you have to guess a date. I put in 2014 here, the beginning of January. So HealthOne will take all the obstetrics transactions that were done since that date. So this is what most people have been doing up to now, and you can see there's a lot of them there that it's taking up. Actually, it's taking miles too many of them. I probably put in the wrong date there, so let's just exit that and do it again. Maternity claim HSE, and the date here should be the 1st of January 2014. Tick it and enter it, and here you have a much better result. Sorry about that. So you get the 3 consultations that were noted, and you get paid for this. So as you can see, even with the new pregnancy module, these documents will work. What they won't be able to do though is you won't be easily able to record the fact that you have sent the form, that you have sent the maternity application, that you've got the maternity number back, that you've sent the claim form, and that you've got the payment for that back. Therefore, we will be encouraging you to use the maternity grid administrative button here to do your maternity application and your maternity referral letter and your maternity claim. But you can only do this if the transactions in the current pregnancy, that is these ones, have been linked to the consultations in HealthOne. Another video will show you how to do this if you've already been using the old module. So if you have this and you click on maternity application, we have a different set of templates because we're extracting the information slightly differently. And this will give you more or less the same document template, but not exactly the same. It will have a different name on it. And you may have to edit this document, because I have HSE in here with no phone number, because I can't know your phone numbers. And that's the application. However, the advantage of using this is that when you are exiting from the claim form, or any of the letters, you will be able to record the maternity application has been sent and what date it was sent. And this will allow you to find a list of patients who haven't had the maternity claim sent, or who you haven't been paid for. So this is the various letters. The referral letter to the hospital will be the same. The problem is you'll have to edit these letters slightly, put your own names in here. These are taken from the user DB, so they should be okay, but I've left these in the template so that you can edit them yourself. And I'll show you how to do that in a minute. And the same with the third letter, the maternity claim. And that's the claim form with taking the antenatal visits as well. But it takes the antenatal visits in a different way, so you don't have to put in any date or anything, because HealthOne knows when the pregnancy started and when the pregnancy ended. And again, it will ask you, do you want to record it? So this is the advantage of using the new templates, that is the templates here rather than the existing ones. There is a difference if I do a template here, and I'll just show you. If you go down to the new document templates are actually called maternity application with no spaces, maternity claim with no spaces, and maternity referral. So when you click this button here and execute the three documents, HealthOne is looking in the normal template place for these three names, and it finds them and it executes them. Whereas your existing documents that you use using the template button up here would probably be called something else. So it's just to be aware of that. And what I'm going to show you briefly now is how to edit these document templates. You will edit them as you would edit any document template by clicking File, Open, Template. And this has always been the case. And you'll have to find the maternity template that you're interested in. And as you can see, I've already told you that this and this and this are the three different letters. So if I want to edit the maternity application, I would do that, and I'd put in here the phone number. I just change the template. It's very easy. 064 65 66 5543. And the HSE, I might put in the HSE South here, for example. What you do have here is you have the address of the patient's details, just as you have with any other template. And you can save that template and exit it, and it will be saved for everybody in the practice. If you're going to do, for example, if you're going to edit the maternity claim, you would again go File, Open, Template, and you go down to Maternity, Claim. You double click on it, and this is your maternity claim, and you might write in here from Dr. John Smith, Dublin 4, or whatever your address is. As you can see, this is a normal template taking stuff here. The important point I want to demonstrate here is that this template is taking information from the pregnancy. HealthOne has a new system for knowing when a pregnancy starts and ends, so you don't have to worry about dates. And the way you put stuff in here, it's in this template. Is to click on Insert Field, Frequent Pregnancy Fields here. Do you see that? This is a new option here. So you have Insert Field, Pregnancy Field, and you see all you can insert the EDD, LMP, and stuff, 6-week check, and the examinations. And that's that one, pregnancy examinations. So HealthOne would pick up the pregnancy examinations. So I edited that one in order to show you the options of inserting specific pregnancy fields here, and that's important. All of this is only possible, let's say yes, is only possible if the pregnancy consultations have been linked. If you're starting with a new pregnancy, there's no problem. HealthOne will automatically link them. But if the patient walks in the door at 30 weeks pregnant, you can use the new system, but you should link the consultations that you've already done to this pregnancy. I've shown you this in a previous video, but I'll show it quickly again now. If you right click on the pregnancy in the grid and you link all transactions related to this pregnancy, it will do it automatically for you. There's none done there because they've already been linked, I suspect. So if you go down here and you right click on this, on that particular transaction, you can do it one by one as well. You can unlink it, therefore I know it's linked. Also, if I click here and I go filter all the transactions of this pregnancy, you can see they're all there. If I go filter on this one, I've already done those as well. See, the filter button is ticked. I unfilter and I go to this pregnancy. So I've gone to the trouble earlier of actually filtering all the transactions relating to all the pregnancies. And again, I'm going into this in great detail in a different video. So to summarize this video, if you're using the new system for HealthOne, you should first of all make sure any existing pregnancy has all its transactions linked to the pregnancy in the grid by right-clicking and linking. Once you do that, then all of these documents will work very well from the new system: maternity application, maternity referral, and maternity claim, rather than using your existing templates. The reason for doing this is that you can now follow things up, such as in the new, I'll validate that, in the built-in analysis section, we have a new set of analyses for pregnancy. A list of all your pregnant patients, a list of pregnant patients without a maternity number recorded, list of pregnant with no maternity application sent, who have not yet had the 6-week check, who we haven't been paid for. So all of that is only possible if you're using the new system and the pregnancy transactions are linked. And that's the end of this video. Thank you for listening.